So I'm Dr. Amanda Tracy. I'm a naturopathic doctor that specializes in perimenopause and menopause. And I have a telemedicine practice that serves women across the United States to help them feel better after 40. Oh, yes, for myself, I mean, my periods never were regular as a teen. And so it kind of started off wonky. And I was told that because I was vegetarian, that was probably why. And I probably should just start eating meat and my periods would get better because they would be around for a few months at a time and then they would disappear for 6 or 12 months. And so I was having times of amenorrhea. And so I was always trying to figure it out, but luckily all the tests were negative. There was no real reason anyone could find. And really, when I had my periods every month for 6 months, I wasn't doing anything different than when I didn't have it. So I couldn't kind of figure it out. But I was always interested in nutrition and health and wellness and science. So that led me down the path of naturopathic medicine. And when I was in naturopathic school, I was, of course, trying all the new remedies I was learning about and trying to figure things out and still never found that secret sauce until after graduating school and being in practice for a few years and really focusing on stress management and switching from being vegetarian to being vegan. And then my periods started to come every month with the full moon. So I did the opposite of what the doctors were telling me to do, and it worked for me. I mean, I was glad they really weren't finding anything wrong. I mean, you want to find an answer. That's kind of like my personality. I like to investigate things and have an answer and have things make sense to me. But at the same time, I should also say when I had my periods or when I didn't have my periods, I felt fine. I didn't have horrible periods or PMS. I felt fine when I wasn't having my periods. I wasn't having hormonal symptoms that weren't like flushing out because I wasn't having periods. So it was in the background of like I just knew like something's not right, but it wasn't necessarily at the foreground of like symptom wise, like making my life miserable. Well, my transition to being vegan was more, it definitely was a transition, just like with vegetarian. It took years. And then I just slowly, again, started not liking dairy, um, which was mostly something I would have when we went out to restaurants because that was the vegetarian thing offered, had eggs and dairy in it. And most of the time at this time. So it wasn't even a big part of my diet. And I had already cut out a lot of dairy and didn't really like eggs too much. So I didn't really have them much at home. So slowly cutting those things out. And then it just kind of, after a few trips where I was probably eating more of those foods because we're eating in restaurants more often, I said, I really don't like these foods. So I'm just going to cut them out, find other ways to make, bake things and make things and just go that route and just like draw a line in the sand and go forward that way. And it was more just because I felt like I was compromising a lot and eating foods that I really didn't enjoy. And I was like, why am I doing that? I just eat what I enjoy and how I intuitively feel my body wants to eat. And over the years, I've improved my diet even further and variety of plants and increasing fiber and reducing inflammation and figured it out. And just coincidentally, after I did that, my periods were regular. So I didn't necessarily do it for my periods at that time. Even if you don't have lactose intolerance or feel that you have a dairy allergy, it is pro-inflammatory. It does impact estrogen levels. Clinical studies have shown that just cutting out dairy for women that still eat meat and eggs, if they're cutting out dairy, can dramatically reduce period cramps, migraines, and pain and heaviness of bleeding within 3 months. So even if you don't necessarily know you're reacting to it, it would be a good experiment to try to just improve the flow and pain and inflammation around your cycle. So things were going really well in my 30s. And then I just got busier and busier and more stress in my life. And eventually, when I entered my 40s, it so almost was abruptly on my 40th birthday. I was thinking, I really need a sabbatical and take some time off. My body was giving me some signs that I needed some time off. And then it kind of just like all hit. And I started to get my immune system kind of crashed. I started getting sick all the time, not sleeping as well. And it could be perimenopause, but it really was more of the stress and burnout that was making my cycle look more like perimenopause. And that's something I saw for many years in my practice and my patients, and still do. Women in their early to mid 40s coming in for hormone support and perimenopause symptoms, but when we're doing testing and actually looking at their life and as a whole, we find that it's more chronic stress that's depleting their hormones, and their ovaries are doing really well. It's just that they're kind of struggling with the stress. I know it is so tough, because when we think of stress, we think of like being anxious and not sleeping and no appetite, or, craving sugar or those things. And that's acute stress. But chronic stress is so tricky. And I'm glad that the conversation around it in the past 5 to 8 years has improved and more people are talking about it, because for so many years I practiced in like an affluent suburb of Boston, and everyone had like big careers and was pretty much stressed and type A kind of energy in that area. But no one would say the word stress out loud. You had to like skirt around it and talk about the other symptoms, because it was almost like people didn't want to say that they were stressed. So I'm glad the conversation has changed and people are like using that word a little bit more, but still chronic stress can be sneaky. Some of the signs of it can be hitting an energy slump, like in the afternoon between 2 and 5, or kind of like craving things at that time, like caffeine or sugar or carbs, or even just any some other symptoms that you have if they're coming on during that time of day, like headaches, or feeling like palpitations, or a little anxious, or being more easily triggered emotionally if it's kind of like happening in that afternoon time. Because of our stress hormones, that leaves us most vulnerable at that time. So even if we're not always feeling like that hair trigger, if it's happening in the afternoon, it could be a sign of chronic stress building up. I mean, I really had to take a lot of time off. And that's something that we want to prevent people from getting to that point. I mean, obviously, when my immune system wasn't doing well and I was taking a lot of sick time off, that wasn't necessarily restorative time. That was to get through. But another doctor and good friend of mine that had gone through something similar that really affected her hormones. And actually, she was told she was in menopause, but she wasn't. She's had natural births and children since then. But her stress was so bad that she suggested what worked for her was taking a week off per month. So, I mean, lots of times we think about, oh, if I could just take that 6 week or 8 week sabbatical and just like calm down, that does help, but it doesn't have a lasting effect. So having that 1 week per month for a year, it took dedication for me to stick to that. And, obviously some finagling with my schedule and my practice, but it was enough to like each month that I had that week, I got better and better. I mean, the first couple months, it really was just relaxing and not, doing much. And then I was moving into more restorative activities and vacations and exercising and more yoga and things like that. But just having that time really, really helped. And that may not work for everyone's, but if you can think about what you can do, even whether it's a day per week, that you do something enjoyable, like reading a book or listening to a meditation or going to a yoga class, that those little pieces, even if they're spread apart by a month, like do add up and help. If you can't think about you having the time for like formal exercise, maybe you can do a 20-minute walk, and then the 5-minute journal. I do 5-minute journaling every morning now. So it's not the same as writing for an half an hour or a stream of consciousness, but having that time when I first wake up helps me like set my day and set the tone. And those little pieces of white space help to prevent the stress from building up. Well, as my cycles were regular after I went through burnout and had things more managed and balanced, I started to notice that my cycles were a little bit closer together. So my periods were closer to like 26 days apart instead of the 29 days apart. And I started to notice some PMS symptoms, like some breast tenderness or some bloating. And normally I don't have any of those symptoms. So just noticing those symptoms was a sign. And then I started tracking my cycles more and started to notice more distinct symptoms of having more energy around ovulation and then lower energy before my period. And it was becoming more pronounced. And that's something that can happen for women in perimenopause, even when they're still having periods, is the different phases of our cycle get more pronounced, and more because the hormones are a little bit more imbalanced. there's still a confusion of like, well, if you're still having periods, it's not menopause. So there's that one piece. I mean, the conversation about perimenopause is improving. So women in their late 30s to 40s now are more aware of that things are changing and that more systemic symptoms could be related, such as sleep changes and mood changes and energy changes. So I'm seeing that in my practice, like more women being a little bit more proactive, like noticing some of those changes and not their cycle changes yet. But often women that I talk to in their later 40s, they haven't been tracking their cycles because they're not trying to get pregnant. It's not really on their radar. So they haven't noticed those symptoms yet. But once we start tracking, we do start to see a pattern. And it's not always that we're trying to get rid of that pattern. It's more knowing that. So you know that you may not want to plan a big vacation or take your kids to like a big amusement park or something like the 2 days before you're going to have your period because you're not going to have the energy or patience for that. So book it another week of the month. So it's like something about embracing it and like kind of knowing what to expect is more empowering, I think. Really paying attention and tracking, you can track your cycles or just track symptoms, just a few symptoms and track them because that really gives you the information to know when things are changing. And symptoms are different for every woman. But just from my own experience with burnout, I look back and I mean, I had that abrupt fall off at age 40, but I really, things were starting to change 2 years before that. So as far as like how I felt and how I was managing everything. So it helps you to be able to adapt and make changes before it becomes a symptom or before it becomes, a condition. So know yourself and track everything.